If you feel as though war veterans should not receive the proper training to become role models in our communities, and even doctors or nurses to keep us healthy, then the healthcare bill is not for you. If you feel as though we should pay for illegal aliens' healthcare, then the healthcare bill is not for you. If you feel as though the state should not have any control over their own abortion laws, then the healthcare bill is not for you. If you feel as though people should not be held liable for getting their own health coverage, then the healthcare bill is not for you. If you feel as though employers should not receive any type of incentive for providing their employees health coverage, once again, the healthcare bill is not for you. If you're perfectly fine with some insurance companies raising their premiums upwards of 22%, then the healthcare bill is not for you. Now according to Mitt Romney, he states, America will not endure a government-run healthcare, a new and expensive entitlement, an inexplicable and surely vanishing cut in Medicare, and an even greater burden of taxes. America is a no because Obamacare is bad care for our America. That was February 18, 2010, CPAC. Yes, Mr. Romney, it does mean cuts in Medicare. But what exactly does that mean? Well, it means that the healthcare bill is actually working. It means that these individuals who are currently on Medicare have gone out and found their own health coverage that provides them better services than they're currently receiving. So that means less money that the government has to go ahead and fund towards Medicare. So as Mr. Romney would state, it will stop unnecessary waste. However, there's a little bit of a different story. Rasmussen report actually supports what Governor Romney states, that America simply doesn't want this. They state 52% of Americans strongly oppose this bill, to whereas only 44 Americans favor. Now this is a survey that's captured 1,000 Americans. Once again, 1,000 out of 300 million. Or in other terms, 0.0003% of the population. Doesn't really give you a clear picture now, does it? So let's face the facts. If it isn't for the country, for where I'm currently at in Utah, 389,000 residents in Utah currently don't have any health coverage whatsoever. I have been personally denied health coverage through Select Health, which is Utah's largest health insurance provider. They state I have what they call pre-existing conditions. I have sleep problems and anxiety. Two situations that they were able to go ahead and come up with. So they've gone through my records, determined that they paid out certain bills, and at this point they've labeled me uninsurable. Which means for the next 12 months until my record's cleared, I have to go without any health coverage. I earn too much for Medicaid, and unfortunately, I don't have any other options. However, had the health bill passed, I would only have to wait 30 days for that pre-existing condition to be cleared. So let's say I were to get ill in between that time period. I probably wouldn't have the money to go get the necessary health care I would need. In an emergency situation, I could end up having to pay thousands of dollars, which I simply couldn't come up with. That could lead to bankruptcy, and now according to Sarah Palin, though, she doesn't really seem to agree with this. She states, why should we fix something that isn't broken? She, quote unquote, we have the best health care in the world. However, according to the World Health Organization, which, as you know, is an extremely reliable source, states that America ranks 37th out of 191 different countries. Now that's 37 out of 191 different countries. Colombia, Chile, and Costa Rica rank far better than us. For this healthcare that Sarah Palin is referring to being the best in the world, it's a far cry from what Ms. Palin's trying to reach. So for those who are concerned about our healthcare being downgraded, the healthcare bill has the information we need to make this fail-proof. As you can see, Colombia, Chile, and Costa Rica rank better than us. It can't get any worse, and based on the provisions that they've implemented, it will only be improved. After doing my own thorough research here in Utah, I've gone ahead and decided to contact our elected congressman. After all, he represents my district. I asked Congressman Chaffetz, what problems do you see with the healthcare bill? He stated that it would increase taxes by 8% for small businesses. False. As well as it could hypothetically lead to a single-payer system. Single-payer, for those who are not too aware of the situation, is something similar to the UK or universal healthcare, which, according to the World Health Organization, they say the UK ranks 18th out of 191. So even a system such as theirs, definitely far better than ours. Either way, going back to the 8%, it's up to 6% if you're paying upwards of $750,000 for payroll and not providing health coverage. For smaller businesses, paying about $250,000, 2%, between $250,000 through $400,000, 4%, and between the rest of that range is upwards of 6%. If they're not providing coverage. If they are, they get tax breaks. So I went ahead and asked Congressman Chaffetz, what would you actually like to see added to this bill, since you seem to so strongly disagree with it? He gave me a list as follows: incentivize preventative care, provide affordable access to insurance, make policies portable, cover pre-existing conditions, allow opt-out provisions for states, allow private insurers to compete across state lines, promote more transparency in pricing and effectiveness of healthcare services. Call me crazy, Congressman Chaffetz, however, all the information you've just given me is already in the bill. Perhaps you may want to read it. Moving on, a famous philosopher by the name of Singer once gave us a hypothetical example for those who are taking philosophy or philosophy majors. If you see a child drowning, would you either help the child, even if it meant ruining your $75 suit, or would you let the child drown? He goes on to say, if you knew someone was dying, anyone, not necessarily a child, would you try to save them? Or would you value your $75 outfit too much to intervene? In this situation, the drowning child is those that are currently uninsured, and the $75 outfit is the tax burden that this healthcare bill would impose. So what I want everyone to do is actually read the facts, not what someone on the news is telling you or what I'm telling you, even though the information I've given you is facts. Go out and do your own research. And that way, instead of paying for someone's health insurance that's currently uninsurable, such as myself, if you don't want to pay my bills, either because you hate my speech or you don't agree with my view, then perhaps this is something you might want to support. It means that I don't have an excuse not to get the necessary health coverage, and in turn means that I'm responsible for my own bills by supporting this bill. It says, look, Ricardo, you can be insured now. So you either do it or you don't. I'm not paying for it. So with that stated, thank you for your time, and I hope you continue to do your own research.